Good morning, good afternoon to those of you on Central and Eastern Time. We'll be starting our webinar on formative assessment in just a moment, so hold on and we will get started momentarily. So good morning again, those of you who've been holding on the line, and good morning to those of you who have just joined us. We're going to go ahead and get started with today's webinar on formative assessment. My name is Sonia Dublin. I'll be your presenter today, and I'm very excited to be here talking with you about formative assessment. So today's webinar will last for an hour. We're planning on being done at 12 o'clock Pacific Time, 1 Central Time, 3 Eastern Time, if I got that correct. And today's webinar is co-hosted by Capacity for Health and Shared Action. Capacity for Health is a program of the Asian Pacific Islander American Health Forum. We're a capacity building assistance program with offices in both San Francisco, California and Washington, D.C. Shared Action is also a capacity building assistance program, and they're based out of the AIDS Project Los Angeles in Los Angeles, California. Both programs are funded by the CDC to provide free capacity building assistance, and specifically to provide free trainings and one-on-one technical assistance for community-based organizations. We work in a range of areas, program areas, including organizational development, infrastructure, program sustainability. We also do a lot of work in evidence-based interventions, public health strategy, and finally in monitoring and evaluation. As I said at the beginning of the presentation, my name is Sonia Dublin, and I'll be your presenter today. I'm a capacity building assistance specialist with Capacity for Health at the Health Forum, and I'm based in our San Francisco office. My background and training is in social work as well as public health, and I've been involved in HIV prevention programming for almost 18 years now. My area of expertise specifically is in program planning and evaluation, and I'm really excited to be here talking with you today about formative assessment. It's one of my great passions to talk about how we can really use evaluation in a way that helps us to improve our programs. So that's what we'll be focusing on today. Before we get into the content of our presentation, let's do a little bit of housekeeping. Just so you all know, you've been muted automatically by our webinar administrators, and we'll unmute you when we get to the discussion section so we can have more of a conversation. If you do have questions that arise during the course of this presentation, you have a question feature in the lower right-hand corner of your screen. Please use that to type in any questions or concerns. If anyone's having any technical difficulties seeing the presentation or hearing us, please write in if you can, and we will do our best to address your needs. Also, when we get to the discussion portion of today's presentation, you can raise your hand by clicking on the hand icon. We'll call on you and unmute you, and you'll be able to ask your question live. So today's webinar agenda, we're going to have a presentation for about 45 minutes. We're really going to focus on understanding formative assessment and looking at a three-step approach to how to implement formative assessment. And the last 15 minutes of the webinar will be dedicated to questions and answers. We're going to try to make this webinar as interactive as possible. We'll be using various polls throughout the webinar, so please participate and share with us your experiences, learnings, questions, ideas. We're also going to be incorporating discussion, particularly at the end, using your question feature and asking you to write in, and we'll share what you write in back with the rest of the participants. Finally, another way we're going to try to make today's webinar really applicable and relevant and interactive is by using a case study approach. So we'll be talking about how to apply the concepts of formative assessment, and particularly how to apply our three-step approach to formative assessment with a real case. And the case we're going to use is an example of an HIV prevention intervention. So hopefully that will be relevant to participants who are on today's webinar. Let's go ahead and start out with our first poll. We'd like to know a little bit more about who's on this call so that we can actually best tailor today's presentation to meet your needs. So we're going to send out 2 quick polls. We'd like to know what kind of organization you work with, and we'd like to know a little bit about your organization's experience with HIV prevention. So while we're doing those polls, I'm going to talk a little bit about our learning objectives for today, and then we'll actually share back the results of those polls with you in just a minute. So by the end of today's presentation, we are really hoping that participants will have a clear understanding of what formative assessment is. We'd like you to understand how formative assessment can be used to improve HIV prevention interventions specifically. Although formative assessment can be used to do program improvement in all areas, we're really going to focus on HIV prevention interventions, and like I said, that will actually be our case study for today. In addition, by the end of the presentation, we'd really like you to be able to identify questions for formative assessment, to name methods for formative assessment, and understand how to select appropriate methods. And finally, and perhaps the most important, we want you to be able to apply what you've learned in your own programs and agencies. So our final learning objective is that we hope that you will be able to identify and have identified some clear next steps to take back to your agency with you. Let's actually take a look at our poll and see who's online with us today. We're launching our second poll. This is my first time doing polls, so I apologize for our technical delay. We actually move forward. We'll talk specifically about the agenda, and we'll come back to the poll results. So like I said, the presentation is really going to focus on defining formative assessment, understanding what it is and how we can use it, and then talking very specifically about a 3-step approach. The first step being defining what it is we want to learn. The second step, choosing methods and thinking about how we're going to learn based on what we've defined as our learning questions. And the third step, and again, maybe the most important, is what we're going to do with what we've learned, how we're going to do our work differently or change our programs or organizations. So why don't we move on actually into the definition of formative assessment. We'll come back to the poll results. All right, let's go back to the poll results then. I'm curious to see who's online today to think about how we can best tailor and adapt today's presentation. So it looks like 64% of you are community-based organizations. Great. And 9% health departments, 27% other. Excellent. So I'm really going to try to talk about how community-based organizations can use formative assessment to improve their programs. And if what we're talking about is feeling like it's not applicable to you, please write in, type in your question, raise your hand and ask a question. I do want to make sure that this presentation feels relevant and applicable to everybody who's online with us today. So let's jump into the first section of the content, which is about the definition of formative assessment. People use a lot of different words for what we're calling formative assessment. People sometimes call it formative research, formative evaluation. Sometimes needs assessment is also used interchangeably with formative assessment. The term formative assessment itself really comes from the language of formative and summative evaluation. And these terms are most widely attributed to an academic by the name of Michael Scriven. He's contributed very widely in the fields of psychology, critical thinking, and perhaps most importantly to our work today, to the field of evaluation. In the late 1960s, he began writing about and really differentiating between formative and summative evaluation. In other words, he was differentiating between the different ways that we use evaluation, or the ways that we can use evaluation, for learning about a program, which is what we would call formative evaluation, versus for talking about the outcomes or results of a program, what we would call summative evaluation. So this distinction in this language really laid the foundation for what we're now calling formative assessment. The specific term, formative assessment, was first formally institutionalized in the world of education, where formative assessment was widely used for examining and improving the learning process. And as you'll see in just a minute, that's really what distinguishes formative assessment from other types of evaluation, is that emphasis on learning and understanding the learning process. So the definition that we're going to be using today for this presentation is that formative assessments are really any type of measurement or evaluation that happen before or after the implementation of a program with the primary goal of learning about and adapting the program. So really going back to the roots of formative assessment in the education world, the primary goal about learning about and adapting the program is really what differentiates formative assessment from other types of evaluation. When we talk about what formative assessment is, it's important also to understand what it's not. And the first thing that it's not is that although it is similar to, it is not the same thing as needs assessment. Needs assessments are generally done before selecting an intervention, and needs assessment really asks the questions of what's happening in the community, who the populations are, what the risk behaviors are, possibly what other resources exist in the community. And hopefully a needs assessment is what lays the foundation for selecting an appropriate intervention. Once that intervention is selected, the kind of work that we do to learn and understand how to best implement our program is what we call formative assessment. Formative assessment is also not about finding out whether or not a program produces results. This is what we would call outcomes evaluation. So really that primary goal about learning about and adapting a program is what drives formative assessment. Even if we may be asking questions about some of the outcomes for our participants, we're asking these questions in order to inform the immediate adaptation and implementation of our program, not to demonstrate the effects or the results of a program in a sort of more long-term or overall way. So formative assessment is really about the learning process and about the immediate implementation and adaptation of programs, not about needs assessment and not about producing outcomes or demonstrating what outcomes have been produced. Let's talk a little bit about some of the benefits of formative assessment. Really with that definition and the emphasis on the primary goal being to learn about and adapt our program, I think it's clear that formative assessment really has the intention to improve our programs, and specifically for most of us on here today, to improve our HIV prevention programs. And this can happen through a variety of ways. First, it often happens because formative assessment helps us to understand how participants are experiencing our programs. It can give us information early on so that we can make necessary program changes or adaptations. And ultimately, it can help to ensure that programs are acceptable, feasible, and hopefully sustainable in the long run. Let's talk a little bit about a case study. We really want to make today's webinar feel realistic and applicable, so we're going to use this case study throughout the rest of what we talk about today. And I've chosen a case study that hopefully reflects a realistic HIV prevention program. And the one that we're going to talk about today is this. We're going to talk about a community organization that has just started offering a new weekly support group for the women partners of men about to be released from incarceration. The group is funded through HIV prevention dollars with the stated goal of reducing women's high-risk sexual and injection drug use behaviors. And we're going to call this Project START. So here you have an example of an organization that's beginning a new program. Hopefully they did their needs assessment, they understood what the need was in the community, and they selected a program based on those needs and based on some of the evidence and some of the best practices that were available to them. So they know quite a bit already. They've defined their target population. They've defined that as the women partners of newly released incarcerated males. They've defined a very clear behavioral risk that they're targeting, sexual and intravenous drug use risk with male partners. And they have a clear plan for what their activities or what their program is, which is that they're going to implement peer support groups. But even though they've clearly defined these things, there may still be a lot of questions that they have before they start their program or as they start their program. For example, if this is a new population, they may need to know how to reach their target population, or what kinds of logistics around how to set up a peer support group are going to work best for their population. They might be working with this population already, but this might be a new type of service for them. If they're offering clinical service or case management services, they may not be familiar with how to structure a peer support group that's going to work best for their population and how to engage and retain them in services. So there may still be a lot of questions that they have and a lot of information they need in order to implement an effective HIV prevention program. And formative assessment really asks these questions. It asks, where am I going? Where am I now? And how can I close the gap between the two? Hopefully you can see from this that real emphasis on learning, program learning and adaptation. And also, when I read these questions, I can really hear the roots in the educational world and how important it is in formative assessment that what we're learning is really about implementation immediately. So again, it really comes back to that definition that we have of formative assessment, that emphasis on the primary goal being about learning and adapting our programs. So we're going to move on to this three-step approach to formative assessment. And the first step is really about what we want to learn. So as you could see in that case study, there were a lot of things that this organization might want to learn. And that really is the first step, is defining very clearly what it is we want to learn from our formative assessment. So formative assessment can have a lot of different questions that could be used in learning about our program. And before we talk about the formative assessment questions, I want to talk for a minute about needs assessment. So just remember that formative assessment is not the same thing as a needs assessment. But I want to show some of the questions of needs assessment just as a way of illustrating for you the difference between needs assessment, which will be done before selecting an intervention, and formative assessment, which will be done after the selection process, but potentially either before implementing or during the early phase of implementation. So needs assessment would ask questions such as, who are we trying to reach? What are their risk behaviors? What are the specific needs of the community or population? And what other resources or assets might exist in the community or for the specific population? And as you can see, these kinds of questions should lay the foundation for us to be able to select an appropriate intervention to address the population or the risk behaviors or the needs that we're seeing in our community. Now, formative assessment, which could be done either before implementation or during implementation, would ask a different set of questions. Before implementation, formative assessment might ask questions such as, how do we reach our target population? So not the who are we trying to reach of needs assessment, but the how do we reach them? We might also ask what specific needs our population has, or how we can successfully engage and retain them in services. So you can see these questions are a little bit more focused and a little bit more specific than they would be during a needs assessment. During the early stages of a program implementation, formative assessment might ask questions such as, are we reaching our intended target population? How do they feel about the services? What's working or not working for them? Or even something such as, are we seeing the initial results that are what we hoped for? So this brings us back to that question of outcomes evaluation. And even though we might be asking about what some of the results are, we're really asking that question during formative assessment with the intention of learning about and adapting our program in the immediate moment, not demonstrating the effects or the results or outcomes of our program. So there may be some overlap in the kinds of questions that needs assessment or formative assessment or even outcomes evaluation would ask. But it really keeps coming back to that primary definition, that primary goal of using formative assessment to inform our program adaptation and implementation in the moment. So let's come back to our case study and look at how we would apply the kinds of formative assessment questions we just talked about to our case. So if you remember, our program, our Project START, is working with the women partners of men released from incarceration, trying to reduce their high-risk sexual and injection drug use behavior through implementing a new weekly peer support group. So if they chose to do some formative assessment before implementing their program, they might ask questions such as, how do we best reach, recruit, or retain these women? Remember, this might be a new population for them, for example. They might be needing to find out how to connect to the population. They might also be asking questions such as, what type of environment and what type of schedule will work best for these women? Even if they're working with the population already, they might need to know how to implement something like a support group, which they hadn't done before. So there's lots of good questions they can ask during formative assessment in the beginning before implementing a program. So even once they've begun implementing the program, they might have some other questions about how to make their program the most effective possible. For example, they might want to know what people like or don't like about the program. This would be a great question to ask sort of in the early phase of a program while there's still a lot of room for adaptation. They might also want to know if women are starting to feel the sense of community or social support that they'd identified as one of the objectives of the program. Again, this might be an outcome of the program, but really we're asking the question with an interest in learning about and how to change the program in the immediate future, not about demonstrating the outcomes in a long-term way. So let's take a break for a second and respond to some questions that you guys may have about formative assessment, about how we're using formative assessment. So Yvonne Marshall, do you want to ask a question? Yvonne, I can't hear you. There you are.
Oh, can you hear me?
Yeah, we can hear you.
Okay. I raised my hand, but it was a technical thing. So.
Okay. Did you get your feedback? Okay. All right. Thank you. Does anyone have a question at this point about how we're defining formative assessment, or particularly about this first step in the three-step approach to formative assessment, which is about questions, formative assessment questions? Remember, if you do have any questions, you can type them in your question box in the lower right-hand corner, or you can raise your hand, and we'd be happy to call on you. We're getting some feedback that the sound might not be good. Are you hearing us clearly?
Yeah.
Great. Well, if there are no questions, let's go ahead and move on. So the second step in our three-step approach is actually how we want to learn what we've defined as our formative assessment questions. So once we've defined our questions, it's really about selecting methods. And now we're going to launch our second poll. So again, trying to make this a little bit more interactive. We'd like to know a little bit what methods you have personal experience with, and then we're going to share those results of the poll back with you in just a moment. So tell us what your personal experience is with some of these methods. As you can see from the poll, the methods of formative assessment are not necessarily different than the kinds of methods we use in other types of evaluation. Again, it's really just about that intention around how we're going to use formative assessment and how we're going to use this evaluation to inform our immediate work and our immediate program adaptation. So while you do your poll, I'm going to move on and talk a little bit about some of the methods of formative assessment we'll talk about today. We're going to talk very briefly about focus groups, surveys, observations, key informant interviews. These are things that are probably fairly familiar to many people on today's call. We'll also talk a little bit about community mapping, community activities, and those may be less familiar to all of you. When selecting methods, it's really important to just remember that methods are really connected to what it is we're trying to learn. So defining our formative assessment questions, or defining what we want to understand, what we want to learn, before we choose our methods is really important in choosing the right kind of method. However, there really is no right kind of method. There are many, many methods. They all have distinct advantages and disadvantages. And there's no right combination of methods that is going to work for every situation or every program. So let's look back at the poll and see what you guys told us about your experience. Looks like we have a lot of experience with focus groups, surveys, 86%, observations, key informant interviews, and a little bit less experience with community mapping and community discovery. That's great. We're going to talk about those methods. I'll try to move a little bit more quickly through the methods that folks are more familiar with and spend a little bit more time on methods that might be newer to you. And again, please feel free to use your question feature. If you have questions as we're going, we'll make sure to address those. So focus groups. Most people, it seems like, are familiar with focus groups. Small groups, usually 6 to 12 participants, maybe an hour or 2 hours. They would last in duration. Focus groups are generally led by an experienced facilitator. It's also often helpful to have a note taker or to do audio or video recording in order to be able to do later analysis. Focus groups can be a great basis for developing interview guides or surveys or key informant interview guides, things like that. In terms of using focus groups for formative assessment, focus groups are great to answer the question, how do we reach, engage, and retain our target population? What do they need or want in the program? And even what do they like or not like in the program? So you can see that focus groups can really be used either before implementing a new program or during the early stages of implementation. We can ask questions that are about how we should start the program and also how we should change the program once it's already been started. Focus groups have some strengths and weaknesses, as all methods do. It can be a really quick way to get feedback from multiple participants over a fairly short amount of time. However, it really does require a skilled facilitator to manage and facilitate the conversation. It also can be timely to analyze the data afterwards. And anytime you get a group of people together in a room having a conversation, we know that their responses can actually influence each other. We call this social response bias. So depending on what we're trying to learn, what our formative assessment questions are, focus groups may or may not be the right method for us. Surveys are another really common method. I think that was the one that most people had experience with. I'm sure everyone knows that surveys can be done in written form, oral form, in person, over the phone, by mail. They're extremely versatile. They can also yield either quantitative or qualitative results based on what we're asking and what we're trying to learn. In terms of how we use these for formative assessment, they can answer a wide variety of questions, everything from how do we reach our target population and what do they want, to are we reaching them once we've already started our program. We can also learn how they feel about the services or what the initial results are from the program that we're implementing. We can learn about what's working and not working in a variety of ways. And I'm sure you can see there's a lot of overlap between the kinds of information we can learn from a focus group or from a survey, and you'll see that as we move forward with the rest of our methods as well. Some of the strengths of surveys, they can be quick and easy, they can be very versatile. Often they're easy to administer if we have access to the audience, the target population we're trying to reach. However, they can also feel burdensome to participants, particularly for working with clients who have low literacy levels or low language skill levels. The other main weakness of surveys is that often we only learn what we know how to ask. It's hard to get the unanticipated learning and unanticipated knowledge because we set up the questions on our survey and we only learn what we've known to ask. Also, we sometimes have issues of representativeness depending on how many people we get to take our surveys and how well those people represent the larger community we're trying to learn about. Observations is another fairly common method. Observations generally are when a trained observer goes and watches out in the community, in an institution, in a service center, and they're watching to try to learn something about a population or a community and to make an assessment of whatever specific characteristics are being observed. For example, we could be looking at attendance rates or time of day or where people congregate. We could be looking at the participation or the interaction dynamics of people within a community or what kinds of things they respond to or don't respond to. Observations, again, can yield either quantitative or qualitative data based on what we're trying to learn. In terms of using them for formative assessment, they often answer questions such as where is the target population? How can we best reach them? What are their interactions or activities like? And as I'm sure you can imagine just from thinking about that one of the main weaknesses here would be that we may only learn what it is we know to observe. So let's say we're going out into a community trying to map where people hang out, a certain population we're trying to reach. If we don't know of a certain area where they might be congregating, we don't even know to go do our observations there. So that can be a weakness. We also definitely need to have trained observers, particularly if there are multiple observers. We want to have consistency across the different observers and what they're observing for. Some of the strengths of observation, though, unlike surveys, there really is no burden on participants. We're not asking anything from them in terms of responsiveness. Observations can also be done very flexibly over a wide period of time, can involve a variety of staff in a variety of different ways. So again, you see the benefits and the weaknesses of different methods and how they can be used for formative assessment. Key informant interviews, I think, is another very common method most of you are familiar with. It's really an opportunity to talk to an individual who has some special knowledge about the topic that we're trying to learn about. The hope is that they represent perhaps a broader perspective or that we can interview a number of people who collectively will represent a broader perspective. And generally, key informant interviews are conducted by some experienced, trained interviewer with either an individual or sometimes even a small group. And interviews can vary in terms of how structured they are, but generally there's a list of topics, whether it's an open-ended interview guide or a very structured interview guide. But they do provide us the opportunity to delve deeper into topics, and we can ask follow-up questions, sometimes we call these probes, as a way to be more fluid and flexible in what we're trying to learn. In terms of using key informant interviews for formative assessment, we can learn a lot about how to reach our target population, what they want or need, how they feel about services. We can also learn whether we're seeing the initial results that we're hoping for or what's working or not working for our population. So again, you see how this can be used either before implementing a program or during implementation to get some feedback about how the program is going. Some strengths of key informant interviews, we can really get a depth of response and we can learn about the unexpected. It's not just what we know to ask, but the conversation and the way that we can probe in a conversation, the way a conversation can turn different directions or someone can offer up new information can really help us learn about something totally unanticipated. The weaknesses or the challenges of key informant interviews, we definitely need, again, trained interviewers, particularly if there are multiple interviewers, to make sure that there's consistency across how interviews are being done. Key informant interviews can also be more intensive to administer, which often can mean for a program that we do less of them, less interviews than we would surveys, or talk to less people than we might through a focus group. And again, this can lead to issues of representativeness, so being careful that we are perhaps mixing methods to get the best results with the best amount of information possible. Let's talk a little bit about some methods that might be a little bit less familiar, like community mapping. I think we had a lower response on our poll about people who had direct experience with community mapping. But community mapping is generally a type of participatory activity, or perhaps a set of participatory activities, in which people, stakeholders, multiple stakeholders sometimes, will identify things about their community, whether those are assets and resources or issues. And the types of activities could be discussions, visualizations, visual artistic expression, ranking of specific items. Community mapping processes can be very formal, or they can also be very creative. We can involve for multiple stakeholders. You can have a group of people make community maps. And again, it can really identify both the assets and the issues in a specific community. Using community mapping for formative assessment is really helpful for defining where our target population is, understanding how to reach them, looking at what their activities or how they're interacting in the community, or to ask the question of what other assets or issues in the community should we be connecting to. So when we think about creating our programs, we might need to think about how to connect to other programs in the community, or how our programs can address a multitude of issues that we're seeing in the community. And community mapping can be a very creative and engaging way to address these kinds of questions. Some of the strengths of community mapping: it's very versatile, it's very creative, really responsive to multiple learning styles. The challenge or the weakness, it can be more complicated, particularly to analyze data across multiple community maps. You can imagine trying to synthesize the maps that were made by a number of different people, or maps that contain a lot of complexity of information. It can be more complicated to analyze that type of data. Community mapping leads us really nicely into one of our final methods, community discovery. And I imagine that this is language that less people know. Community discovery is a term that's very specifically used in the community-level evidence-based interventions, what we call the EBIs. So the community-level EBIs, such as popular opinion leader, empowerment, community promise, DUP, RAP, many of them include a very formal, specific formative assessment process in which a variety of methods are used. For example, community discovery often includes observation, key informant interviews, and focus groups, among other methods. And it's a comprehensive process that's used really specifically to define a target population and to understand the behavioral norms that an intervention is attempting to change. So there's some similarity between that and what we talked about in terms of the questions of needs assessment. However, formative assessment and community discovery are really used after the intervention has been selected to fine-tune, to kind of hone in on really specifically who the target population is and what the behaviors that we're trying to address are. Using community discovery for formative assessment often answers questions such as who is the target population, how do we reach them, and what are the behavioral norms of that community or of the target population. The strengths of community discovery, it's very, very comprehensive. It uses a mix of methods which can give us a wider variety of information. However, it can also be complicated to implement and can be burdensome on agencies because it does draw on that whole wide mix of methods. The final type of methods I want to talk about today are actually participatory activities. And participatory activities really aren't a method in and of themselves. All methods can have varying degrees of participation. But in general, participatory activities or participatory methods, they come from a participatory evaluation framework. And participatory evaluation really has as an explicit goal the development of skill, learning, and assets for the participants themselves. Participatory evaluation is often an explicit redistribution of power. It's really an empowerment-based process. And so participatory activities, all methods that have varying degrees of participation, can have varying degrees of an empowerment basis. So the explicit goal of empowerment is really important when we think about participatory activities, as is the fact that participatory activities can be very integrated into existing program activities. So when we talk about formative assessment, we talk about the kinds of methods we can use. Many of the ones we've talked about previously, we would be doing in addition to the program itself. Participatory activities, on the other hand, can be integrated into the program in a way that feels very seamless. So it doesn't seem that we're doing something different or above and beyond the activity itself. So when we looked at our case study, for example, the peer support group, participatory activities would be integrated into the content of the peer support group in a way that did not feel the participants like we were doing something different. So it's a way to integrate formative assessment into the existing activities of a program. Participatory activities can often include things like group brainstorms, cooperative interviews, and game-based learning. Those would be some of the more typical participatory activities. Using participatory activities for formative assessment, we often learn how people feel about services and whether we're seeing the initial results that we hoped for or what's working or not working for our participants. So those questions are all things that we would really be asking after a program has started rather than before a program has started. Strengths of participatory activities, like I said, they can be very engaging for participants. They can really be integrated into the format so they don't feel like something different or above and beyond the activities of a program. However, like our community mapping or community discovery, they can be more complicated to analyze because of their complexity. It also can take more time to do a full participatory activity, more time, for example, than a survey or more time than a key informant interview. And we also may have to spend more time training staff to implement participatory activities than just to distribute or implement a survey. So let's take a break again for questions about the kinds of methods we've just talked about. So again, remember, if you have a question, you can type it in and we will read it out loud and respond to it, or you can raise your hand to be called on. Any questions about the material we've covered so far, about the kinds of methods we can use for formative assessment? Okay, we'll go ahead and move on with the presentation. Marcos, did you have a question? Marcos Martinez? No? Okay. If you do have a question, Marcos, please either write it in or raise your hand. We'll try calling on you again. So let's go ahead and continue with the content of our presentation. We'll have some more time for questions again as we get closer to the end. So let's come back to our case study and think about how we would choose methods based on the formative assessment questions we identified for our case study. So remember Project START. It's working with the women partners of men about to be released from incarceration, trying to address their high-risk sexual and injection drug use behavior, and specifically through implementing a peer support group, a weekly support group. So one of the formative assessment questions they had before implementing was how to reach, recruit, and retain these women. And so for that question, they might choose to do observations out in the community. They might choose to do some key informant interviews or a focus group with women partners of about to be released men. They might choose to do some community mapping or even to do some surveys. So you can see there's a wide variety of methods that they could be using to answer this question. They also had asked about what type of environment and schedule would work best for these women. Again, they could do some interviews, they could do focus groups, they could do surveys, and they could choose a method that would help them to answer both of these questions if they wanted. They also have some questions after they've started implementing the program. If you remember, they wanted to learn a little bit about what women liked or didn't like about the program. And for this, they might look more towards a method such as participatory activities, something they could integrate into the existing structure of the weekly support group. They might also choose to do a survey or to do more key informant interviews or to do another focus group. That would be another way to gain that information. They also had wanted to learn whether women felt a sense of community and a sense of social support. Remember, this was one of their outcome objectives, but they're not asking the question now in order to learn or to demonstrate the outcome of their program. Rather, they want to know whether they're on the right track to where they're trying to get. So to answer this question, again, they might choose some similar methods such as participatory activities, surveys, interviews, focus groups. And you can see that they might choose a couple of methods in order to answer those 4 formative assessment questions. So they might implement more than one type of formative assessment, something before they start the program and something in the early stage of implementation. So let's keep walking through our case study. Let's assume that they do this. They implement some formative assessments. So in order to answer their first question, they decide to hold some focus groups. And what they learn, their findings from their focus groups, are that in order to reach and recruit the women, they're going to do best if they do outreach in incarceration facilities on visiting days. And they're really going to rely on social networks and word of mouth to promote their support group. What they learn about retention, women tell them they really need to offer transportation and food vouchers if they want women to participate. In terms of their second question, they also do focus groups. So let's say they do focus groups and they ask both these questions in the same focus group. That'd be very efficient for them. And what they learn is that the location needs to be somewhere close to public transportation, and that the women want an environment that feels very casual and comfortable, maybe somewhere with couches, somewhere loungy, and that the best schedule for women is going to be a weekday evening, particularly Tuesday, Wednesday, or Thursday in the early evening. So you can see they've learned a lot of information that's going to help them to plan a program that's most likely to succeed. In terms of their questions after they've started implementation, they wanted to learn what women liked or didn't like, and they chose to do interviews. And what they learned from their interviews was that the women really liked having food and having check-in time and having a very open format to the group. What women didn't like was that there were too many specific presenters. So already you can see how quickly they're getting feedback that's going to help them to change the way they're structuring their program. They also learned that women really are starting to feel comfortable. So their final question was about whether women felt a sense of community and social support. And for this, they chose to do some participatory activities during their group time. And they learned that women were starting to feel comfortable with each other, but they didn't like having new people join and leave the group. And they'd like to know more about each other's lives outside of the specific topics that the facilitator is introducing. So they can take this information and they can make some very immediate changes to their program. And that is really what formative assessment is about. It's about that process of learning and adapting our program. So that brings us to the third step, which is what are we going to do differently once we've learned something from our formative assessment. So looking at their findings, what our case study chose to do was that when they learned about needing to do outreach and using social networks, they decided to do once-a-month outreach on Saturdays at all the local prisons. They decided they would definitely offer transportation, food, and childcare to best support the women's participation in the program. They chose a location at a community center rec room, so we'd have that comfortable, casual environment. And they chose to offer the group on Tuesday evenings from 5 to 6:30. So you can see how immediately responsive they were able to be based on what they learned in their formative assessment. Once they started the program and they did formative assessment to find out what women liked and didn't like, and they learned that women liked food and check-in time, they decided they would definitely continue offering food. And based on the women's response about not liking having so many presenters, they decided to reduce the number of their presenters to once a month instead of every week. And finally, women's feedback, the fact that they were starting to feel comfortable but didn't like having new people join, helped the program to realize that they needed to close the group and have a 3-month session and then invite new women to join in the next session. So you can see some of these were fairly small and easy decisions, and it might have felt intuitive to the program if they had known the population or known the community. But formative assessment really allowed them to put a finger on the pulse of what was needed and how people were feeling and responding, so they could really best implement and adapt a program that was going to be very, very responsive to the needs and desires of their population. In terms of using the findings from formative assessment, it's also really important to think about, sorry, I'm missing a slide here. It's really important to think again about that primary goal of learning and adapting a program. We want to think about identifying all of our important stakeholders to share our findings from formative assessment with. So that might be program staff, the participants themselves, partner organizations in the community, even community members. If we're going to make immediate changes to our program based on what we've learned in our formative assessment, we really want to share that back with the people that have been involved. It's also very important to be clear about what we can and cannot change as a result of our findings from formative assessment. So for example, we might be able to change the group time or location, but we can't open up a group to participants' partners, for example. If we look back at our case study, our target population was the women partners of incarcerated men. So even once those women's partners had been released from incarceration, if they weren't part of our defined target population, it's possible that we really couldn't open up the group to include their partners. So it's important to know what we can and can't change before we start our formative assessment, so that we understand how we can use our findings and how we can use what we've learned. It's also important that if we seek participant feedback as part of the process of formative assessment, that we really make sure to share those findings and share our planned actions back with those participants. That's really about the responsibility and accountability of those relationships. So we are done mostly with the content section of our presentation today. We have one more piece that we're going to use for closing up, but I'm going to take a break for some questions. It looks like we have a question about additional resources for community mapping. That's a great question. There are actually a number of websites and some books about community mapping, and I will post those. I'm going to segue into the next I'm going to segue up a couple of slides just for a second and then come back. One of the resources we have as we end this webinar is that we're going to be continuing this discussion on an online forum that's hosted by Shared Action. I'll put this link back up in a minute, but you can go onto the Shared Action Forum website, and under the webinars section of the list of available forums, you can click on Formative Assessment. Once you register, you'll be sent login information, and then you'll be able to post questions and respond to questions. Also, I'll be posting the slides and a recorded version of this webinar on the forum, and I will post some resources there about community mapping. I don't have on the tip of my tongue the link for some websites and some publications about community mapping, but I'd be happy to put those resources up on the forum for people to access. So we have another question about whether certain methods fit better with certain kinds of interventions. That's a great question. So I think the real bottom line about method selection is that it really goes back to trying to identify what it is we're trying to learn. Often people talk about participatory activities as going well with empowerment-based interventions or participatory interventions. But my personal feeling is that it really is based on what we're trying to learn, how we've defined those formative assessment questions, and what our resources are in an organization. So if we have enough staff and we have time to train our staff to go out and do community mapping, for example, or to do key informant interviews, that's really different than if we have such limited resources that the best we can do is to put a survey on the front desk of our service center and let people pick it up on their own. I think what makes the most successful method is really about choosing a method that is realistic for us to implement given our resources, and that's going to best address the kinds of questions that we're trying to answer through our formative assessment. Do we have other questions? Does anyone have a question that they'd like to ask live? If you do, you can click on your hand button, raise your hand. We'll call on you and you can ask your question live. No other questions? So I'm going to go back a couple of slides here for a minute, because if you'll remember, we did say that our final learning objective was that we'd really like this to feel concrete and practical and applicable. So our final learning objective was really about you having identified some next steps for your organization. So in our final 8 minutes together, I'd like you to think a little bit about where your organization is in terms of using formative assessment. Are you planning to start a new program? Have you already started a new program? Do you have a program that's been running, but you really are still trying to adapt it and fine-tune it and make it the most effective fit for your population or community? So given where you're at in your organization and how you might think of using formative assessment in your work, I'd like to know what are your top 2 formative assessment questions and what methods you might use in order to answer those questions. And what I'm going to ask you to do is actually to type it in your question box, and we're going to send that back out so other people can see the kinds of responses that you guys are sharing. So what are your top 2 formative assessment questions, and what methods might you use to address those questions? I'm going to give you just a minute to work on that, and then I'm going to come back to next steps in terms of our side, next steps and further resources. So please think about your top 2 formative assessment questions, the methods you might use, and share those back with us by writing them in your question box. So while you're doing that, I did mention as further resources the online forum at Shared Action, and I'll put this slide back up in just a moment for anyone who hasn't gotten the website yet. But the other resource is that, like I said at the beginning, both Capacity for Health and Shared Action are funded by the CDC to provide free capacity building assistance. So we do individualized capacity building assistance, trainings, technical assistance, one-on-one consultation with community-based organizations. And we can be reached via email and via phone, and we can help provide further support and resources for you, specifically for your programs and your organizations. So in addition to continuing the conversation at our online forum, we'd really like to encourage you to access capacity building assistance through either our organizations or any of the CDC's funded capacity building assistance providers. So do we have any responses about identified formative assessment questions? So far what people have typed in is that their personal priority questions are to learn how participants are feeling about HIV prevention presentations, and the method chosen for that was to use focus groups. Great. Another question is, where do I go to reach the men I'm trying to give outreach information to? How do I find them in the places they hang out at? Excellent formative assessment question. And the methods selected were survey, observations, or community mapping. Great. Thank you for sharing these. We have another formative assessment question of how do we engage and retain our target population in a new intervention. The methods selected were key informant interviews, focus groups, and surveys. Great. Excellent. We have another formative assessment question of how do we attract the right participants and how do we keep them interested in finishing the session. Great. So that's really, the recruitment retention piece. And the methods selected were community mapping and key informant interviews. So you can see just from these responses that have been shared that there are lots and lots of different kinds of questions that we can ask about formative assessment. And depending on what we're asking or what we're trying to learn, there's lots of methods that we can use to identify the information we're trying to learn. So that really brings us back, I hope, to what our learning objectives were for today's presentation. So really, we had hoped that you would walk away from this webinar with a clear understanding of what formative assessment is. I think we've defined it, and we've talked a little bit about what it is and what it isn't. We really were also hoping that you would understand how to use it specifically to improve your programs and how to improve HIV prevention interventions. And to do this kind of through our three-step approach, first defining the questions of formative assessment, which you've just done and you're sharing back with us, and then being able to select methods and understand how to select appropriate methods that are going to help you to learn what it is you want to know to best improve and implement your program. And finally, our last learning objective about identifying clear next steps for your agency. I hope all of you have thought about that and identified that, whether or not you've chosen to share that with us through the question feature. We've got about 3 minutes left, so I will open the floor back up for more questions. If anybody would like to ask a question live, we have a little bit of time for discussion. You can raise your hand. We'll call on you. We would be happy to entertain any questions you have about formative assessment or how to use it with your program. If you don't want to raise your hand, you also can type it in the question box feature in the lower right-hand corner. We'll read it out loud and respond to you there. Doesn't look like we have any questions on the floor right now, so I think this will conclude our webinar. Thank you all so much. Oh, we have a question. Great. What is the best formative assessment strategy for community-level intervention? Excellent question. So I think we talked a little bit about community discovery and how that's very commonly the language we use in community-level intervention. But some of the other activities that we talked about in terms of community mapping, I think, can be really helpful. And really, it kind of comes back to what it is we're trying to learn. So community-level interventions, we need to understand a lot of things about our target population, their risk behaviors, the other assets and resources in the community that we want to integrate with and network with. And how to really create community-level change means we have to have an understanding of sort of the whole community and the whole picture of the community. So I think some of the more qualitative methods, like community mapping, can be really useful for that. But also, there's lots of smaller pieces. If we're trying to understand risk behaviors, for example, we might need to also do some key informant interviews or focus groups or surveys to understand about specific behaviors. So really understanding what it is, what all the pieces are that we're trying to learn before we implement a community-level intervention can help us to choose a mix of methods that's best going to answer those questions. There's generally not one method that's going to answer all of our questions, so it's really about choosing an assortment of methods that will be compatible and implementable and give us the overall ability to answer the questions of formative assessment. Looks like we have another question about what is a formative assessment strategy for individual level programs. Again, I would say it really goes back to what it is we're trying to learn. So individual level programs, again, we need to really know who our target population is and what their needs are. We might also really need to understand some of the nuances of behavior and how decisions, individual level decisions are being made and how to effectively support behavior change. So for that level of nuance, we might really want to do some key informant interviews where we can do some probes and really kind of get deeper into the questions of why what people's behaviors are and how we might best influence them. But we also may need to understand the community before we can do an individual level intervention. We still need to know where our target population is and how to reach them. So things like community mapping or observations or focus groups might still be important. So really there's a wide variety of methods that can be used to answer the formative assessment questions for individual level or organizational level or community level interventions. Do we have any last questions? I think we have about a minute left on our allotted time for today's webinar. Well, if we have no final questions, I will go ahead and close out today's webinar and just remind you please to join us at Shared Actions online forum so that we can continue our conversation and continue our learning together about formative assessment. I want to just thank you all for being on today's webinar. It's been a pleasure to talk with you about formative assessment. I'm excited to continue our conversation on the forum and excited to hear about the ways that formative assessment is being used to improve HIV prevention interventions. So thank you again for joining us today, and this concludes today's webinar. The slides and an audio, a copy of the presentation and the audio as well will be posted on the forum. Thank you for joining us.